More than 30 members of various social services converged in the United Counseling Services headquarters on Monday, April 24th, to hear about how the agency's plans for how a $1.2 million federal grant from the Department of Health and Human Services will be deployed. The money will be used to bolster the federal Head Start and Early Head Start programs the agency administers. The grant, one of only 2 given to social service agencies like UCS in New England, and one of only 15 approved nationally in the current round, will enable UCS to triple the number of children under the age of 5 they can assist before they enter preschool or kindergarten. Betsy Rathbun-Gunn, the Director of Childhood Services for UCS, described what the grant will do.
So we are renovating a new facility that we're going to be leasing, and then we're adding additional slots to our current facility, and then we're partnering, which is enhancing slots to another 16 slots. So we are increasing the number of early childhood infant toddler slots by 32, but overall 48.
This was the 3rd time UCS has sought grant money from the federal government, and the 3rd time turned out to be the charm, she told the assembled group. The money will go over a 5-year period to support children from low-income families to obtain child care and educational assistance, and to help them get ready to transition into kindergarten and elementary education. Head Start, a program launched as part of the Great Society social programs of the 1960s, provides comprehensive early childhood education, health, nutrition, and parent involvement services for low-income children and their families. Head Start was originally conceived as a catch-up summer school program that would teach low-income children in a few weeks what they needed to know to start elementary school. The Head Start Act of 1981 expanded the program. The 48 slots in the Head Start program will be reserved for children in Pownell and Bennington, Rathbun-Gunn said, since these were the towns that showed the greatest need.
At first we had written the whole county into the grant, and then that was going to be the 64 slots. And when they came back to us and said they couldn't fund the grant at the level that we had applied for, we negotiated with them to really look at our direct need right here in Bennington and prioritize that need. One of the things that Head Start always does, though, is look at our community needs assessment on a regular basis. And slots can shift. So if we find that Manchester has a higher need than parts of Bennington does, we shift those slots according to that need. But right now we've identified Bennington as our primary service area, but we always are looking to see where the need is. And we do agree that the need is still up in the North Shire, but when you looked at the numbers, they were much higher here in Bennington.
Eligibility for the Head Start and Early Head Start programs is based on a point system, which looks at whether a child is in foster care, living with a family on public assistance, is homeless, and along with other factors such as whether their parents or guardians are working or in school or incarcerated. If they are children of teenage parents, and their ages are also taken into consideration. A child who is 4 years old gets more points than a 3-year-old because their window of opportunity for help before school starts is less. Overall, Bennington County ranks high compared to other parts of the state, according to data distributed by the UCS at the meeting. About 700 infants and toddlers are estimated to need child care services in Bennington County, but at least half of the infants likely to need care don't have access to so-called regulated programs, meaning programs that are licensed or registered with the state. About 75% of infants and 44% of toddlers, meaning children between the ages of 2 and 3, don't have access to so-called high-quality programs, which are ones which participate in the state's quality recognition and improvement programs. Between 10 and 12 new staff positions will be created by this grant, but it's not always easy to find qualified social workers, Rathbun-Gunn said.
Good question, too, and that we need to have a minimum of a child development associate certificate for folks to be able to work with us. So we have built in some professional development to hire folks and be able to get them with that certificate. But it's a workforce development question, too. We're really pleased to be able to bring these funds directly to Bennington. As I say to folks, our salaries aren't sky high by any means. So for a lot of folks, this money will go directly back into our community. These folks will be, leasing our cars, buying our groceries, doing all those things. So not only is it providing resources for folks that need infant toddler care for working purposes, but also will provide new jobs for folks to be able to continue to make Bennington their home.
That's similar to other social service agencies around the state, where many jobs are going begging at comparable agencies in Rutland and Washington counties, along with other parts of the state. UCS is aiming to have the new expanded availability of services in place by next September. For the GNAT TV News Project, I'm Andrew McKeever.